Chapter 15, Part 3, the Human Immunodeficiency Virus. This last portion of Chapter 15 is an important topic because our understanding of HIV has in large part led to advances in epidemiology, the study of how diseases are transmitted. This has also been important for viral transmission especially. This has led to advances in molecular biology, and research in HIV has also led to AIDS and gay activism. So let's start by talking about the history of HIV, which causes AIDS. So AIDS is acquired immunodeficiency syndrome, and it's caused by HIV. HIV is the human immunodeficiency virus, and this was first described in 1981. And since, it's become a worldwide epidemic. When it emerged on the scene in the 1980s, this hasn't gone away. So this has some important significance, not only in the United States, but also globally. Now, HIV is a retrovirus. It's made of RNA, and that RNA from the virus is transcribed into viral DNA once it enters into the host cell. Where did this unique virus come from? Well, researchers suspect that HIV evolved from a similar virus called SIV. SIV is the simian immunodeficiency virus, and this infects chimpanzees in West Central Africa. So when we take a look at some statistics of HIV, we see that cumulative deaths from AIDS caused by HIV, well, in the United States, there's been close to 700,000 deaths. Globally, 35 million. AIDS deaths per year, about 12,000 in the United States, about 1 million globally. Individuals currently infected with HIV. In the United States, about 1 million. Globally, about 37 million individuals currently infected with HIV. New infections per year in the US, 39 to about 40,000. Globally, about 2.1 million new individuals are infected with HIV per year. So this not only is a cause of concern for individuals within the United States, but this also has some significant concern globally, especially Africa, where it's thought to have originated. So AIDS is acquired immunodeficiency syndrome, and this is caused by the human immunodeficiency virus. Now, this virus passes through fluids. This is present in saliva, it's present in tears, and it's also present in sweat. However, the concentration of the virus in these fluids is so low that it's not likely to be transmitted through the saliva, the tears, or sweat. Rather, the virus must enter into the bloodstream. And when the virus enters into the bloodstream, it infects white blood cells. So it's in a much higher concentration in blood, semen, and vaginal secretions. So these are major contributors of HIV, and it's in a higher concentration in sex fluids and blood. So here we have a cell that's been infected with HIV, and all of these little particles are HIV infectious particles that are budding off. One infected cell can release many thousands of infectious HIV particles. And we'll talk about why a little bit later in the lecture. So let's discuss modes of transmission. Now, individuals, they could acquire the virus through a number of ways, one of which is by a contaminated blood transfusion. That's why high-risk individuals, they may not be able to donate blood at the Red Cross. Sharing injection needles. If an individual injects themselves with a needle for intravenous drug use, then they share that needle with somebody else, well, they could transmit the virus in that fashion. The virus could be passed from an infected mother to her fetus. And this could occur during pregnancy, where the virus can pass from the mother through the placenta, infecting the offspring, or this could even pass through breast milk. If a mother is infected and she breastfeeds, that virus can be in a high concentration in the breast milk, and that can infect the baby. Now, other modes of transmission include vaginal and anal sexual intercourse. The type of sexual encounters could greatly impact the transmission rate of the virus. We take a look at individuals engaging in coitus. Oral sex is low. Whether the person is giving or receiving oral sex, transmission of the virus is low in this respect. Coitus transmission is low. This is still possible, absolutely it's possible, but the transmission is lower in coitus than anal sex. Anal sex, the person inserting a penis into anal sex, this increases the likelihood, but the person that is really at most risk is the person that is receiving the anal sex. Now there's an important reason why this is the case. Individuals that participate in risky sex practices like anal sex without condoms, they're at a much higher risk of contracting HIV from an infected person. And the reason for this is because the anus is not lubricated. Because the anus is not lubricated, it is far easier to tear than a vagina. So if the anus is torn, then that means that virus could be introduced because blood cells, white blood cells in particular, are right in that vicinity. So this has at least a 5 times higher infectious rate, where an individual receiving anal sex would be much higher risk of acquiring the virus than other sex practices. Now for this reason, the highest transmission rate is amongst male-to-male sexual contact. Heterosexuals are the next highest rate, many of which who participate in risky sex behavior. Those that are promiscuous, those that engage in anal sex, and those that don't use condoms. So here we see male-to-male sexual contact is the highest incidence of HIV transmission, followed by heterosexual contact, injection drug use, IDUs, these would be needles. There's also some cultural implications as well. Some ethnic groups are at higher risk of contracting the disease. The highest risk is African Americans, many of which are in impoverished areas. Next, white individuals and Hispanics. Now, oftentimes, transmission of the virus occurs in a greater frequency in impoverished areas. And we're going to talk about some of the antiviral medications and treatments that can be administered. Unfortunately, because these are not readily available in low-income areas, sometimes that viral transmission can increase, in some areas more than others. Now, HIV differs from normal viruses because genetic information is encoded in 9 RNA genes. Upon infection, HIV replicates and embeds itself in white blood cells. It then uses host cell machinery to replicate more HIV. So let's take a look at how white blood cells defend against pathogens, including viruses and bacteria. Now, to understand how HIV is specifically transmitted from an infected person to a new individual, it's important to have some understanding of immunology. So in the next couple of slides, I'm going to discuss some general characteristics about cells, and then I'm going to elaborate more on immune cells. So first, all cells have surface proteins, and these proteins are used for communication, attachment, signaling, and recognition. All cells have them. Our cells have them. Viral cells have them. Or viruses aren't cells, but bacteria have them, and viral components have them. So when our body identifies molecules or proteins on foreign cells or viruses, our immune system responds. It gets triggered. So foreign molecules, these are molecules that trigger an immune response, and these foreign molecules are referred to as antigens. Essentially, our white blood cells identify viral proteins and bacterial proteins, and they identify that does not belong in the body. So they prompt an immune response against them. So here we have a bacteria, and this represents some of the surface proteins on bacteria. And these surface proteins, because they're foreign on a pathogen like bacteria, they're considered an antigen. Now, to defend against these antigens, there are antibodies. Antibodies are produced by white blood cells. And these antibodies, they attach to and they neutralize foreign antigens. Essentially, these antibodies produced by a type of white blood cell attach to this pathogen. And when they attach to this pathogen, what they're going to do is they're eventually going to neutralize, target, and kill that pathogen. So antibodies are very important in defense against both bacteria and viruses. So let's talk about some of these white blood cells and how they play an important role in activating the immune system. And let's take a look at which white blood cells make these antibodies. Well, first, a T lymphocyte is a white blood cell. It's also referred to as a CD4 cell, a CD4 T lymphocyte, or a helper T cell. This is all the same exact cell. So these helper T cells, known as CD4s, they're important. They're called helper T cells because that's exactly what they do. They help. They stimulate other white blood cells. They stimulate B cells, and they stimulate cytotoxic T cells. Now, B cells are a white blood cell that make antibodies. These are antibodies that recognize, attach, and kill pathogens like viruses and bacteria. Cytotoxic T cells, these are white blood cells that recognize and kill cancerous cells, as well as infected cells of the body. Both B cells and cytotoxic T cells are activated and stimulated by helper T cells. Helper T cells activate and stimulate both of these. So let's take a look. Here we have a helper T cell. Now this helper T cell, an important part of its identification, which is very important and we're going to talk about again, is this component called CD4. This CD4 happens to be a protein that is found on these helper T cells. That is really important because it is the CD4 protein that helps give this helper T cell its identity. Now remember, helper T cells help. They stimulate or activate other white blood cells. Like this white blood cell, the cytotoxic T cell. This, upon activation, can now kill virally infected cells and cancer cells. This helper T cell can also stimulate B cells. B cells produce antibodies, and remember, these antibodies they attach to, they target pathogens like bacteria and viruses. So now that we understand helper T cells, activating both cytotoxic T cells and B cells, now let's talk about HIV. HIV is a retrovirus. Here we have a representation of HIV and some important components. HIV consists of 2 strands of RNA. This represents RNA inside of HIV. Reverse transcriptase enzyme. Now this reverse transcriptase enzyme is very important. This can do a very unique trick. This is going to be the enzyme that's going to replicate the viral nucleic acid. However, when it replicates the viral nucleic acid, it's not always accurate when it does so. It's error prone. It makes some mistakes. And that's actually problematic to us during infections because it creates new variations of HIV when it replicates. This is very important for the virus. Next, it has a protein coat called a capsid. This is a protective coat for the enzyme and the RNA. And it has an envelope, and that envelope is represented here, these circles, with these important glycoprotein spikes. Now these glycoprotein spikes can be identified as the outermost portion is GP120. And this portion that extends is GP41. Now, GP120 is important for attachment, whereas GP41 is important for fusion. So we see the virus has an envelope, a glycoprotein spike used for attachment, entry. It has a protective capsid coat, its nucleic acid as RNA, and reverse transcriptase enzyme used for copying that RNA. So let's put these together, because we have our helper T cell, and with our helper T cell, with our characteristic CD4 protein, well, the virus exploits that CD4 protein on the helper T cell. If you look, GP120 fits perfectly with this CD4 protein. HIV specifically targets helper T cells. It's because these helper T cells have this characteristic CD4 protein. This actually serves for an immunological purpose, but HIV exploits that. So when HIV infects this helper T cell, this weakens the cell, and eventually this is going to kill the cell. But in the meantime, rather than using this cell to be a stimulatory cell, this is used for a viral replication factory. So GP41 attaches to CD4, the virus now enters into the cell, and this helper T cell loses its stimulatory function. It no longer activates cytotoxic T cells, and it no longer activates B cells. This is devastating. These helper T cells lose their stimulatory function. They can no longer stimulate other white blood cells, and over time this leads to a weakened immune system. This weakened immune system over time is acquired. And that is how HIV causes acquired immunodeficiency syndrome, because the body cannot effectively defend itself against routine bacteria and viruses that it comes into contact with. So now let's take a look at the viral pathology. We learned that the virus attaches to the host CD4 site. Using viral glycoprotein 120, it attaches to CD4 of a helper T cell. GP41 promotes fusion. The capsid is uncoated, viral RNA and reverse transcriptase are released. Reverse transcription occurs, where RNA from the virus is converted to double-stranded DNA. That's accomplished by reverse transcriptase. This is a very unique and important step. The virus migrates, then it integrates into host DNA. The reason why converting this single-stranded RNA into double-stranded DNA is so important for the virus is because our DNA is double-stranded DNA. And that means when it migrates, it can integrate permanently into an infected individual's DNA. Viral components are then produced, where infected individuals produce viral proteins, and they produce viral RNA. The cell produces new HIV viruses, and these weaken and kill the host cell. The virus then spreads and infects new cells of the body. So what we have here is the virus being introduced to bodily fluids, where white blood cells, like this helper T cell, having a CD4 receptor, these are found within bodily fluids. These are found in blood especially. So here we have the virus infecting an individual. GP120 attaches to CD4. That viral GP41 causes the virus to fuse with the cell, releasing its viral RNA. It's reverse transcribed into viral DNA, It then migrates, integrates into the host DNA. Now it produces viral RNA and viral proteins. It then can bud out of the cell. So the virus converts its viral RNA into double-stranded DNA and permanently integrates into DNA of a host cell. That is one of the reasons why there is no cure. This integration is permanent when individuals get infected. So this virus spreads throughout the body, and it's in fluids like lymph fluid, blood, vaginal secretions, as well as semen. Now, when individuals get infected with HIV, it may take a little time for the virus to show up. Seroconversion describes the change from an individual that's HIV negative to HIV positive. And this is usually performed through blood work. This can take anywhere from 6 weeks to 6 months for individuals to produce antibodies against the virus. And then these antibodies could be identified, because after all, an individual would never produce these antibodies unless that virus was inside their body. So individuals may experience fatigue, a mild fever, sore muscles, occasional diarrhea, and swollen lymph nodes. They often get night sweats. But when you take a look at these symptoms, fatigue, fever, sore muscles, diarrhea, swollen lymph nodes, maybe night sweats, this sounds an awful lot like a viral infection in general. What we have here is upon entry and infecting an individual, the virus begins to soar. This really increases quite fast. And then white blood cells, they begin to identify and kill off the virus, so then it dips. Well, these CD4 lymphocytes are being killed, and they begin to gradually decline. In the meantime, this virus begins to slowly and incrementally increase. So upon initial infection, this virus replicates very quickly. This is usually the highest risk of an infected individual transmitting it to another person, is upon initial infection. Then the virus decreases. Individuals may experience an asymptomatic stage, and then they may experience initial disease symptoms. Now, this duration of time is indefinite. We see that an infected individual, upon entering AIDS, is, sometime after 7 years. In some extreme cases, this could be just a couple of years, maybe a few years, 2 or 3 years. In others, they could be non-progressors, and this may take several years plus. This may take well over 10 years, 12, 15, maybe even 20 years before they start to experience immune failure and AIDS. However, on average, this could be anywhere from 5 to 10 years for them when an individual gets infected to progress to immune failure and then AIDS. So when individuals begin to experience immune failure, this is often referred to as ARC, AIDS-related complex. This is sometimes called HIV symptomatic disease. Individuals, they'll often experience swollen lymph nodes, weight loss, constant fever, extensive diarrhea, overwhelming fatigue. The T cells in their immune system drops in half. They're starting to become immunocompromised. They often experience thrush, which is a fungal infection in the mouth. They can't control it. Also, this could awake a latent shingles virus. They may experience shingles, which is an outbreak of herpes through bands of the skin. When individuals develop AIDS, usually individuals, when they develop AIDS, they're severely immunocompromised, and that's because their T cells have dropped to only about 10 to 20%. Normally, individuals have about 1,000 T cells per microliter of blood. Individuals with AIDS, they have below 200 T cells per microliter of blood. They have about 20%. Because their immune system is destroyed, you cannot defend against parasites. There's wasting, progressive and extreme weight loss. HIV can enter into brain cells. Individuals that are infected, they develop AIDS dementia complex. They have cognitive impairment. They're not thinking or acting or talking right. This is also correlated with rare cancers and lymphoma. Infestation of opportunistic parasites kill individuals once they're diagnosed with AIDS. And typically individuals survive less than 1 year after they've been diagnosed with AIDS. Here we have disseminated herpes. Here we have a rare cancer called Kaposi sarcoma. This rare cancer is really cancer of blood vessels. And these spots are found all throughout the body of many AIDS patients. Again, this is very rare. Here we have a closer look at Kaposi sarcoma. The reason why individuals develop opportunistic infections, like fungal infections in the skin, in the mouth, they often develop pneumonia. They experience these rare cancers that they very rarely ever occur except in AIDS patients. It's because, again, they're severely immunocompromised. Those white blood cells that would defend against cancerous cells and viruses and bacteria and fungus, those cells are no longer activated nor stimulated. So individuals, well, they get infested with pathogens. Now, fortunately, there is treatment. However, this can be complicated because treatment of AIDS is directed by both complications associated with the disease and the viral replication cycle. There's neither a cure nor a vaccine for AIDS. However, treatment involves combination therapy. This is abbreviated as HAART. This stands for Highly Active Antiretroviral Therapy. And this is a combination of drugs, often referred to as a drug cocktail. So with treatment, death rates due to HIV and AIDS have been reduced, and they've been reduced significantly. Now, here we have a combination of antiretroviral drugs, and individuals may take drug cocktails throughout the day, perhaps multiple times a day. And the idea is combating the virus on multiple fronts. So individuals, it's not certain exactly when they would take these. There are some physicians that recommend that infected individuals with HIV, they take this when their T cell drops to about 1/2. These can be very expensive. In the past, these medications have been quoted as being thousands of dollars per month. Perhaps even $450,000 to $500,000 throughout the course of one's infection. So the way that they work is these antiretroviral treatments, they may block attachment, like in this instance. There was a drug called Fusion that was approved by the FDA in 2003. This helps reduce the viral attachment. They could be reverse transcriptase inhibitors. They could essentially block the replication of the virus. They could be integrase blockers, where the virus, even if it does infect a cell, it's prevented from integrating into the host DNA. And lastly, they could interfere with viral proteins. If viral proteins are being affected and interfered with, then this could affect the docking and budding out of the virus. So these are all ways that the viral transmission and the viral replication can be reduced. And it may be reduced significantly. The problem is, because this virus, when it replicates, it's RNA into DNA, because it's error-prone, it creates new variations. And when these new variations are produced, sometimes these new variations can emerge. That's another reason why there is no cure. There's no vaccination, because upon entering and replicating, it replicates and it creates a wide variety of the virus. So not all medications are effective, and even when an individual produces antibodies against the virus, it's not effective against all of the variants produced. Now, post-exposure prophylaxis is an antiretroviral therapy that can also prevent an infection, and this can be administered immediately after an individual is exposed to HIV. An example of this could be a mother that's infected with HIV who delivers a child. They may administer post-exposure prophylaxis to that child immediately to reduce an incidence of infection. Another example could be if a healthcare professional accidentally pricks themselves with an infected needle, or maybe an individual who was raped or the subject of some type of sexual assault, especially in prison, where individuals may be infected and a known person infected rapes another inmate. That may be an example of a post-exposure prophylaxis application. Pre-exposure prophylaxis is when the antiretroviral drugs are taken before exposure to HIV. Now, this may occur for a couple of reasons. Perhaps individuals that have an HIV-infected partner, but they're not infected themselves. They may take pre-exposure prophylaxis to reduce the viral spread. Possibly those individuals that are high-risk individuals, such as those individuals that participate in promiscuous sex. They don't always use condoms. This might be more common amongst gay males that are promiscuous and they don't always use condoms. So Truvada is a once-daily pill, and this can help reduce the rates of transmission. This is more common in areas like San Francisco and New York. This is less common, pre-exposure prophylaxis is less common in areas that are impoverished, like in the South. So antiviral drugs have greatly reduced death rates. Life expectancy has increased greatly. Magic Johnson, all-star for the Lakers in the 80s. In a press conference in 1991, Magic Johnson announced that he was HIV positive. That was nearly 30 years ago. With antiretroviral drugs, some estimate that individuals, if they're taking these antiretroviral drugs, their life expectancy may only be 1 or 2 years earlier than previously expected. So these can significantly help reduce death rates. Now, these antiretroviral drugs, they don't eradicate the virus from the body. So those drugs must be taken indefinitely. Also, drug resistance can develop. As I mentioned previously, sometimes the virus creates variations, and sometimes these drugs aren't effective against these new variations of the virus. Also, these drugs, they could have side effects, like nausea, diarrhea, weight loss, vomiting, fatigue, and these could individuals may experience side effects differently. So I hope this has led to a greater understanding of what HIV is and how HIV is so dangerous, why there's no cure nor vaccination for HIV, and how engaging in safe sex could reduce the incidence of STDs in general. So avoiding STDs, well, although there are cures to some types of STDs, there are not cures for all of them. The best way to avoid STDs is abstinence, sexual exclusivity, choosing carefully, knowing your partner's sex history, asking your partner about their sex history. That's important. Although it's embarrassing sometimes to ask or even foreclose information, it is absolutely important. Avoid risky behaviors. Avoid multiple partners. Communicate. Disclose information. Even if it's embarrassing, it's important. Be informed. Be proactive. And there are devices, they're highly effective. They're called condoms. Use condoms.